fake case today is Schnuffles. Schnuffles is a 3-year-old. He's a Springer Spaniel, and he has had incomplete humeral ossification. So he's got elbow issues. It's bilateral. His right forelimb is worse than the other, but they're both pretty bad. Now, he's still got his testicles, and he's a spaniel, and he's from a working stock. So he is all the time, and he goes all the time. And the owners really didn't see that there was any problem there. So they were like quite shocked when a diagnosis of significant OA in both elbows, and they found that hard to compute. But what we did on the clinical examination is we showed them that when you went to try and touch his elbows, he was like, yeah, I'm just not playing a game today. Get out of the room. But I'm doing it with a smile. Right. And also when they actually did manage to get him to sit still and they were trying to flex his elbows, they would only get part of the way before they got kind of like a dead end. So there was no flexion. There was extension, but no flexion. And also, when you looked at him, if he did stand still at all, you saw a little roach in his lower back, and his back legs were slightly tucked underneath him. And if you brushed him down there, he had a and you didn't know, is he ticklish or is your hands down his back. So they've come to see you. They know that they've got this issue, and they want to get on top of his pain control. So they want to get on top of the pain before they start looking into other interventions. What sort of things would you be doing? First consult with you.
First of all, you make a very good spaniel. I'm really impressed at your spaniel. It's perfect. This is a really tough one, isn't it? But not an unusual one. I think for anybody veterinarian on this chat, I don't think it's unusual to see a case like this. And this one's so hard. You put everything into one case, including the funny name. But I don't know about you. First of all, elbows are so hard. To me, they're the hardest to control pain. And it's because, of course, as quadrupeds, they put so much weight on their front limbs. Yeah. And then we've got this young dog, so he's looking at a lifetime of treatment. So we have to get the owners prepared for that and not do that silly thing like, well, I don't want to give him drugs because he's young. Like that is not, it's his pain that we give drugs for, not his age. And then starting to what therapies can we utilize in this dog without creating too much owner burden? This is a painful dog. So what can we do that they can also do? And, I don't know how you feel, but the very first thing I would do is start this dog on some anti-inflammatory drugs. We know that is a drug class that we expect to work almost, at least in part. It's not going to be all of the pain relief in this dog, but starting with a drug that we know should work, regardless of the dog's age. That's not the point. It's his pain level. I guess unless it was a neonate, which thank you for not making it a neonate. We expect some pain relief. It's not going to be enough, but that's really going to help not only with immediate pain control, but also keeping that owner burden under control, because we're not sending home 4 drugs and trying to replace an NSAID. We're sending it home with an NSAID. And I would also immediately start this dog in some kind of physical therapy. He really needs that. The lumbar palpation that you described, I don't know what you think, but that screams trigger points to me. Like he's so painful elsewhere. And I'm glad that the owners were already convinced that he has some pain. If they're not completely on board, when they see the response to the NSAIDs, again, it's going to be an incomplete response. But when they see that, I think they'll completely realize that he's painful. So unless they're completely contraindicated for the dog and the owner, start with NSAIDs. Would you start there as well?
Yeah, no, absolutely. And I think you're right. It's really worth saying to people that what a vet prescribes in the initial period isn't necessarily going to be for life. And I think that's a massive, massive fear in the public sector of, if you go to see the vet, they're going to give you a drug and they're going to expect you to stay on it for life. And that actually is stopping people going to the vet. So the big take home now for this part of the talk is, please don't not go to your vets for fear of being put on meds long term. Right. That isn't how we roll. It's a case of start, see what it does, reassess, modify. And if you get all the background sorted, there's a big chance you'll be able to come off of them. Right. So please don't be in fear of the vet for fear of long-term meds. But no, I do exactly the same. Would